The test to do for male infertility. The basic investigation, semen analysis and sperm function test. These are two different things, though they may sound the same. For semen analysis, we want to take 2 to 3 samples that we collect over several weeks. For each sample, we want to tell the patient to collect the sample after 2 to 7 days of abstinence from sexual intercourse. Though you're used to giving patients 3 days, abstain for 3 days, then take a sample. So this sample, we want to deliver it to laboratory within an hour. It can be taken from within the medical facility, or there are patients who may choose they want to take it from home. But delivery should be within 1 hour, and keep the sample warm. And take the sample, you write the time taken, and you want to keep it warm by putting either in the pocket of your jacket or trouser. But point to note is deliver it within an hour and not the time. The measurements we want to take, we want to look at the ejaculate volume, we want to look at the liquefaction time, we want to look at the pH of the semen. Microscopically, we want to look at the sperm concentration, we want to look at the total number of sperms, we want to look at the morphology and shape of the sperms, we want to look at the motility of these sperms. Then we want to look at the at presence of leukocytes, or the concentration of leukocytes, which is a sign of infection, so that your doctor can decide on appropriate antibiotic treatment to give you. Then we want to do an MAR test. MAR is mixed agglutination reaction. You want to detect anti-sperm antibodies. This is in Uganda. It is now done. Lancet laboratories are doing it. You have MBN, they are doing it. So you want to do MAR. MAR, for example, in asthenospermia, which is associated with immunological infertility. What I'm saying is you've done parameters are looking normal. You want to do an anti-sperm antibody. Then we should note that a routine semen analysis only provides useful information that is concerning with sperm production, concerning with sperm motility and viability, concerning the patterns of the male genital tract, concerning the secretion of the accessory organs, ejaculation and emission of semen. What I mean is that the information is useful for initial assessment of infertility in the male, but it is not a test of infertility. Yes, I'm saying semen analysis does not necessarily test for fertility. What we are saying is that it provides no insight into the functional potential of the spermatozoa and even subsequent maturation process that is required to achieve fertilization. Therefore, you can do semen analysis, the routine one, and the parameters are all okay. Then you wonder why the patient is failing to make a woman conceive. We are saying semen analysis does not necessarily give us a fertility result, though the result may correlate with fertility, but the assay is not a direct measure of fertility. Therefore, when we do semen analysis and our parameters look fine, but the patient fails to make a woman conceive, that is where the sperm function test comes in. It is a specialized test, so your doctor, basing on your history, will want to do a particular sperm function test, since they are highly specialized and expensive. Yes, so the next investigation we want to do are the reproductive hormone assay. Reproductive hormone assay, we want to look at follicle stimulating hormone, the luteinizing hormone, you want to look at testosterone, you want to look at prolactin. One thing we should note is that where you have an isolated case of low levels of testosterone, recommendations are that you test early in the morning and you test for free testosterone. Then we should note that high prolactin levels are associated with sexual dysfunction and pituitary diseases. So you want to do reproductive hormonal assay. Then let's go to the imaging tests or the radiology tests which are common. the obvious ones. As in medicine, we know that common things are common. So you want to do scrotal ultrasound scan. The scrotal ultrasound scan, we want to assess for testicular abnormalities and even detect varicocele abnormalities. Testicular abnormalities can range from the injuries or infections that we saw that are causing chronic otitis, then any other. There are so many testicular abnormalities we saw. So you want to do a scrotal ultrasound scan, then you want to do a transrectal ultrasound scan. Though transrectal ultrasound scan is not a routine test, we do it where we see low ejaculate volumes. We investigate seminovesicular obstruction or absence and ejaculatory duct obstruction, and also where we find that we have sexual dysfunction like erectile dysfunction, where you may be suspecting conditions like BPH, because transrectal ultrasound scan you want to look at the prostate too. Then maybe for people who are having erectile dysfunction, an additional test you want to do is the penile Doppler, which can give us an insight of whether we are having a venous leakage. At least it is common for those that are aging that right now you can do your transrectal ultrasound scan and the prostate gland is okay, but the patient is having an erectile dysfunction that doesn't necessarily seem to be coming from emotional or stress concern. You want to do a penile Doppler that can help us to diagnose like the venous leakage. These are common tests, by the way. I do not want you to think we are doing something that is so extreme, no. Then another test that you may want to do, if the above are not helping, you want to do a viscography. Here we have puncturing of the vas deferens at the level of the scrotum, and then we inject a contrast. This is to rule out obstruction, where a normal test would show us a passage of the contrast along vas deferens, seminal vesicles, and ejaculatory duct and into the bladder. And this one here, we want to do it to rule out obstruction of the male genital tract. Then you want to do a venography. We want to use it to diagnose and even guide embolization treatment of varicocele. Then you want to do a testicular biopsy. If all others you do and you're not getting proper results, or you do and then you're finding that you may need to do a testicular biopsy, then you may need to do it. Testicular biopsy can be ultrasound guided too. Yeah, I think that is some few. Maybe others, the obvious one, you want to do the investigation for sexually transmitted diseases. You want to do a syphilis test. You want to do a urinalysis. Then maybe you want to do a semen culture and sensitivity. Yeah, those are obvious ones, and I think that can be enough for our